Good morning, my friends. It is Dr. Darla, and I have just a quick second before my next patient gets here. So, I wanted to talk with you about something that happens quite frequently for me. It's not that it always happens in the office, but usually when I'm out and around in the world and people ask me, hey, what do you do for a living? And I mention that I'm a doctor, then I get oh, well, I have this symptom. What do you think it is? Or, oh, my knee hurts. What do you think that is? Or, how can I treat my back? The problem with this is that in medicine, if you really want to get down to what the problem is, you have to do a little bit of research. Sometimes some symptoms are really obvious, but many times the symptoms that you have can be overlapping between particular diagnoses, and that diagnosis may definitely change the treatment plan. So it's really a difficult thing for people to find out what their problem is when the doctor doesn't have all of the information. So for example, if you are struggling with digestive issues, well, digestive issues have a broad range, right? Digestive issues could be nausea, vomiting, diarrhea, constipation. They could be heartburn. They could be, you could have anxiety or depression that's showing up as a relationship to digestive issues. You might have inflammatory bowel disease that is causing one of those symptoms, like Crohn's or ulcerative colitis. You might have an overgrowth of small bacteria in your system called SIBO. You may have a candida overgrowth or a simple dysbiosis. It could be that you don't have enough enzymes to digest your food properly, and so you're experiencing digestive issues. If you don't have enough hydrochloric acid, you might be actually getting heartburn. So as you can see, many digestive issues are caused by a variety of things. Maybe it's an H. pylori infection, but without proper testing, we're really just throwing a whole bunch of mud at the walls. And I see a number of people asking questions in social media, and I love the fact that people are seeking answers to their problems, but they'll go into a group of other people that are not necessarily medically trained, and they'll ask a question like, hey, what's the best thing that I can do for my digestive issues? And then a number of people will say, oh, you should try this, or you should try that, or you should try something else. And the truth of the matter is, we don't even know what you're treating yet. So the fact that everybody's throwing out a suggestion for a problem that we haven't even identified, well, that doesn't make a whole lot of sense to me. I can throw a ton of mud at the wall, and I might find something that sticks, but it's going to be frustrating, it's going to be time consuming, and it's going to be expensive. So I would encourage you, if you, whatever your symptom is, actually go to somebody who can assess it and treat it, and stop trying to try this, and then being like, oh, nothing works. If you get with a practitioner that will look at you as an entire person and not just as a singular system, you have the opportunity to really figure out what is going on and how it might be showing up in other areas of your body. Your body will talk to you. It tells us a lot of things, but you have to learn how to listen to it. And we are not good as a society at listening to our bodies and really adhering to things that it's telling us. So if you're constantly fatigued, that's not a normal state. You need to address whatever the cause of that fatigue is. If you're having heartburn, I don't care what the commercials have told you on the TV, that's not a normal state. Just because you turned 40 doesn't mean you should automatically start having heartburn. There's a problem, and you need to get to the bottom of that. If you're having aches and pains in your joint, it's not just because you had another birthday. It's because there is something fundamentally imbalanced in your body that you need to address and treat. But without the person properly looking at it, doing the workup, whether it's imaging or blood work or specialty tests or stool collection or whatever it is, maybe you need a scope if it's a digestive issue. Maybe you do need a partnership between an alternative care practitioner and your gastroenterologist, right? Maybe you need a collaborative team. But do yourself a favor and find out what the actual problem is with proper testing so that then you can establish proper treatment. So I hope that's helpful for you today. If you need any assistance, I am more than happy. We are accepting new patients. So we do distance patients as well as local patients, depending on what it is that we're treating and what makes sense, both for the patient and for myself as the practitioner. I'm Dr. Darla. I will talk to you soon. Sell my clinics. Bye-bye.